G'day and welcome back to the channel. So in today's video, I want to talk you through what you need to do to successfully overcome a BAKERS cyst at the back of the knee. Now, a BAKERS cyst can be a consistent issue for a lot of people. And from what I see clinically, one of the main reasons for that is that not only are we treating that BAKERS cyst, but we're often forgetting or neglecting or overlooking the reason why that BAKERS cyst is there in the first place. So if you're someone who's been dealing with a BAKERS cyst, or you know someone who is going through a BAKERS cyst, please make sure that you hang around towards the end of the video so that you can have the broader perspective around why that's there in the first place. So you don't have to keep getting injections or keep getting fluid removed or taking painkillers and all this sort of stuff that we sort of get stuck in the cycle of doing when we've got a BAKERS cyst. So getting into this, obviously, the exercise that we're going to go through are going to be calf-specific exercises to try and help some of these symptoms. The reason for that is that when you have a BAKERS cyst, that calf muscle tends to be sort of over the top of that as it sort of goes across the back of the knee. And a calf muscle or a tight calf muscle or a painful calf muscle is a really common symptom associated with BAKERS cysts. So we're going to go through two ways to try and hopefully get on top of those symptoms. But then we're going to quickly go into some exercises that you can work on to improve the function of that area. Now, a lot of people don't realize, or it's not promoted enough, that if you are someone who has a BAKERS cyst and you've been given that label, we need to also attach to that this idea that there's probably also some meniscus dysfunction going on as well. So in my experience as a physio, if there's meniscal issues, and that can be something as sinister as maybe like a tear or something like that, or something as less sinister as some wear and tear and degeneration, you wouldn't necessarily go as far as to say arthritis, because arthritis has got a lot of negative connotations in terms of what your expectations are going forwards and how limiting that can be for you. If we stick to the words wear and tear, that probably gives us a more positive outlook on this dysfunction. But the presence of dysfunction in that meniscus tends to be the reason why a lot of BAKERS cysts occur. So if you're someone who's getting that drained consistently, getting injections into it, taking pain medications to sort of manage that BAKERS cyst, it's very short-sighted if you're not also looking at your meniscus and then also taking a bigger step back to understand why that meniscus is a problem in the first place. So that's going to be the second part of the video. I'm going to hopefully give you that really strong perspective so that you have the information you need to know going forwards to conquer this long term. So getting into the symptomatic stuff, getting into the calf-specific stuff, one of the best ways to decrease calf tightness and calf restriction is with a wall calf stretch. So what we want to get you to do basically is, with your shoes on or off, doesn't matter too much, is if you try and get your heel as close to the wall as possible, and then we want to keep your legs straight to start with. This is going to target the gastrocnemius, the longer muscle in the back of the calf, the one that's most commonly affected if you have a BAKERS cyst at the back of that knee. What it'll get you to do, heel as close to the wall, squeeze your butt cheek, and then holding onto a door frame or something close by, just try and come up over your foot as far as you can. Try and get your hip as close to the wall as possible. You'll find that you'll feel a really powerful stretch in that calf muscle up closer towards the back of the knee. Now, to make this very specific to you, what I'd like to get people to do is, from this position, keeping your butt squeezed, just gently twist your hips and your knee, rotate from side to side, see which angle gives you the best access to your calf tightness. So for me, if I rotate a little bit more towards the camera, I feel it a little bit more on the outside of my calf, which is where I tend to get a little bit tight. Some people, when you twist away from the camera, might find it a little bit more on the inside of the calf, on the inner side. And if you're someone who overpronates and dumps inwards when you walk a lot, you might find more tightness in that area. But make sure that this is very specific to you. Find where you need to be. And then again, as we always say on the channel here, it's not enough to hold a stretch anymore. It's not good enough. It doesn't get the results that we want. What you have to do to make this highly effective and highly efficient quickly is, wherever you feel that tightness from this position, we need to tense that tightness up. Activate the muscle, activate the part of the muscle that's tight. By activating that, when we release that, it gives, so that you can then go a fraction further than you could before. So again, try and tense up that calf muscle. You might need to push your foot or push your toes into the wall from your ankle, sort of push back against the stretch to really activate that tight spot. Hold that for 5 to 10 seconds. Again, when you relax, you should feel you can go a little bit further again, as you can hopefully see me doing. So that version of the stretch is a brilliant way to decrease the amount of resistance in that calf muscle that might be reactively and reflexively tightening if there is some irritation at the back of that knee. So that's a great way to try and get through some of those symptoms quickly. The second way that we can do this is with a foam roller or a tennis ball or a lacrosse ball, whatever you feel most comfortable using. And what we want to basically do here is we want to try and shear free some of the restriction here. So the common misconception, again, I'm on a mission to try and get this out of people's systems, is we're not looking to roll around on the roller. It does have some benefits, obviously, in terms of sort of shearing free some of the connective tissue and the fascia and things like that. There's definitely a place in the world for rolling on things. But when we're trying to improve the mobility of tissue in this particular instance, what I find works best is if you move the roller up and down to a point where you feel an area of tightness and tenderness. So for me, I'm at a level where I feel some thickness in this calf that needs to go. Same thing as we did up against the wall. If you roll your leg outwards and inwards, go looking for the area that feels the most restricted. So I've found a little thick knot here, just a little bit on the outside. You might even be able to see it sort of flicking over a little bit as I roll over there. So I want to capture that part of the muscle. What I want to do here is I then want to bend and straighten my foot. So what I'm doing here is I'm compressing that tissue and then shearing that tissue past the ball by including movement. Now, this is relatively comfortable for me, so I can really get up on top of this and really ask that tissue to shear free faster. Again, if it's too easy again, which a lot of people it may not be because it can be quite tender, then again, put some extra body weight through that, put another leg on top of that, and then gently bend and flex that ankle until you feel like it starts to shear free. Now, if you have a friend lying around, they can definitely put some pressure through this and make it and take it to an extra level as well. Obviously, don't be silly when you do that, but just go hunting up towards the back of the knee, up and around for all the areas that feel restricted, and tend up. And then when you stand up and walk around again, you should feel like there's instantaneously more freedom there. It shouldn't feel as tight. And hopefully the pain and any symptoms associated with that have reduced to a certain degree. So as I always say on the channel, please hold me to this. If you don't see an immediate improvement in some way with those exercises, and we're not just talking about pain, but an immediate improvement in how mobile and free you are after doing those exercises, you probably haven't made a change. So we need to figure out what's gone wrong there. You deserve to see a change every single time you do these two exercises, and any exercise to be fair. So they're the two exercises that are great to feed some slack into the back of the knee, hopefully take some of the symptomatic pain and discomfort out of that BAKERS cyst. But moving on to potentially the more important part of this conversation as to why that BAKERS cyst is there in the first place. Why is that meniscus not happy? What's going on with the way that you're loading that knee that's a problem? And from what I find clinically, personally, this is going to sound a little bit strange, but often there's too much unwanted rotation in the system. So what I mean by that is with the knee is basically a hinge joint where in a perfect world, there is some subtle rotation that happens when it's sort of locking and unlocking at end range. But in an ideal world, a stable knee acts like a hinge joint where it bends backwards and forwards. And we know that basically, instinctively, we know that's the case. However, if you have some restriction below your knee at your ankle and some restriction above your knee at the hip, when you're moving in a linear plane, it reduces your movement options. So if you need to, for example, when you're walking, if you need to take a step, but what you find is when you try and take a step, you don't have enough range of motion at the front of your hip to extend, then what your body will do is it will essentially move around that and rotate around that to complete the task on your behalf. The same thing happens at your ankle. We've discussed this a lot on the channel before, is that if you're trying to bend your knee up and down, then essentially what will happen is if you run out of that range of motion before you should, then your body has to find a way around that to keep going. So if we can remove some of the restrictions at the ankle and at the front of the hip that will force your leg to rotate more than it should, creates that rotational shearing at the knee in ways that it's not designed to handle, then we can take the pressure off that meniscus, and the consequence of that, the compensation starts to decrease with that BAKERS cyst. So again, if you want to get rid of the BAKERS cyst symptoms at the back of the knee, not only do we have to look what's going on at the front of the knee, but look at what's going on with the rest of the leg, improve the way you're loading that knee so it has a chance to settle down long term. So again, as we've done on the channel a lot before, One of the best ways that I've ever seen to free up an ankle joint quickly is the banded ankle stretch. So if you can grab a band, attach it to something that's not going to move behind you. So again, I really like having the band above the ankle joint. When we're in the position I'm about to show you, I find that gives me better access and my patients better access to capsular stiffness at the back of the ankle joint, which is where most of that restriction tends to be. But you see a lot of people have the band below the ankle joint. Again, test both out, but I'm confident that above the ankle joint, even though it's a little bit counterintuitive, seems to get the best results. And at the end of the day, that's what we're after. So what we want to get you to do, take a big step out as far as you feel comfortable. Be very respectful for how your knee feels. Obviously, we want to work within that. Take your hips past your foot and then gently bend your back ankle as far as you feel comfortable, making sure that when you do this, so again, imagine the band's going behind here, that when you bend that back ankle, bend that back knee, that you're not dumping inwards to go around that restriction. So make sure that your knee stays out. You may not go as far as what you could if you dumped inwards, but try and respect the integrity of the ankle joint and the knee. Hold this position. You should feel like there's a really nice stretch going on at the base of the ankle in a way that you probably haven't felt before. Hang it here for a minute or two, as much time as you feel comfortable. If you feel like your quads are getting tired or your knees getting sore, just make sure that you're not squatting down on the exercise. Again, make sure your hips go past the foot and then bend the ankle at the end. And you should feel like it genuinely makes a difference in terms of how you're loading up that knee. And again, what that gives you is it gives your ankle more movement options so that it's not forcing you to dump inwards and create that unwanted rotation of the knee, setting that meniscus and the BAKERS cyst up to fail. Now, as we were saying before, we can also see that there's a restriction for a lot of people at the front of that hip. So again, if you spend a lot of time sitting, that anterior hip capsule or the hip flexors at the front of the hip can tend to get quite tight. And again, as I said, when you're walking and trying to extend that leg, it doesn't allow you to extend in a sagittal or in a linear plane. So it then forces you to rotate around that, creating a lot more rotation at the knee. So again, the best way that I've ever seen to decrease restrictions at the front of the hip is with the couch stretch. So please, if you haven't done this before, if you have a BAKERS cyst, this might be a very hard exercise to do initially. So don't do this on the floor like I'm about to. Do this on a chair. It's much easier, it's much safer, it's much more comfortable for you. But I'll show you it here for the purposes of this exercise, of this stretch. So what we want to get you to do basically is we want to get you to place your knee into the back corner of a wall or the back of a chair. So if this is the seat of a chair where it meets the back of the chair, want it into the back corner of that chair with your legs straight up. Now the other leg needs to come up. Now this is what's uncomfortable for a lot of people. So if you're up on a chair, so if my knee was up here, for example, this would be much more comfortable for you. Now we want to get you to start in this position first, where you're more sort of horizontal compared to vertical, and just press your hip to the ground. See if you can find some tightness at the front of that hip. See if you can sort of scour around, see what's stopping you. Like we did with the calf stretch against the wall, it's not good enough to stay here when we're doing a muscular stretch. It's a little bit different with a banded stretch when you're focusing on the capsular restrictions, but wherever this feels tight, I'll get you to squeeze your butt cheek again and then push your knee down into the ground. Really try and activate this muscular tightness that you're trying to open up. Hold that for a few seconds, then relax. See if you can push that hip a little bit further. Once you've had enough of that, the second part of this exercise requires us to come up into as much of an upright position as possible. You'll feel a horrible tightness at the front of the hips, potentially down the front of the thighs as well. So just come up to the angle that you feel very safe and comfortable. For some people, it'll be here. Other people, it'll be here. If you can get all the way up to the wall, that's fantastic. But again, you can play around with where your hips are in this position, but we need to go hunting for and remove any of that restriction through the front of the hips down to the front of the thigh. That's going to be acting, as a handbrake on that knee. It's going to be pulling a lot of sort of tension in through that knee, loading up that meniscus differently, but again, forcing your leg to potentially rotate more than it's designed for and sacrificing that meniscus. So same thing with the first part of this stretch. Wherever it feels tight, try and tense that up. You might have to push your foot back into the wall from your knee. Do whatever you need to do to tense up that muscular tightness. Hold this for a few seconds, relax. You'll be able to go a little bit further. Again, I urge you to take this one easy. This one is almost the anti-sitting stretch. So a lot of people are really tight from all the sitting we do. You genuinely might have to start more horizontally to begin with. Just gently work your way up to this over time. what you'll find is it should instantly make the front of that hip feel looser. You'll be able to walk better, run a bit better. It'll be a significant improvement to the function of your overall leg. Now, I fully understand that when we're talking about a Baker's cyst at the back of the knee, it might sound a little bit strange to be talking about ankle mobility and hip mobility. But the key point I always want to ram home is we can't think of your issues in isolation, because your Baker's cyst isn't a Baker's cyst floating off individually in space on its own. It's physically attached to the back of your knee, which is made up of your thigh and your shin, which runs into your hip and your ankle, to your foot, to your hips, to your low back, all that sort of stuff. So functionally, everything's physically connected. And if we're not taking a step back to understand what in your system isn't functioning normally, we've got to stop thinking about a Baker's cyst as a Baker's cyst and think of it as the part of your leg that isn't enjoying how the rest of your leg is functioning. That's the thing that's sore and uncomfortable, maybe because the meniscus is an issue, but that meniscus should not be an issue if everything's functioning fantastically well above and below that. So I hope that was really helpful. Please let me know down below how you find that Baker's cyst is going, specifically with these exercises as well. Once you start to remove some of those handbrakes above and below the knee, over the next few days, the next few weeks, you should feel like things are moving better. And I'm hopeful that your symptoms are going to start to settle down relatively quickly. So let me know how you go with that going forwards. But with that being said, thanks for watching. Hope it helps, and we'll see you soon.